Hello, WeTHRIVE Child Care Centers, and welcome to the second webinar in the WeTHRIVE Learning Collaborative recorded series for child care centers and schools. My name is Andrea Liptak, and I'm a health educator and registered dietitian with Hamilton County Public Health, helping to implement the WeTHRIVE initiative within child care centers. WeTHRIVE Child Care Centers are committed to making steps in policy adoption, menu changes, and implementing family engagement strategies that help to enhance the nutrition and physical activity environment of this center. Today's learning collaborative topic is one of great interest for providers, as families are key players in the effort to teach healthy habits for children you care for. While it can be a challenge to engage families in today's fast-paced world, it's important that, as child care centers, you provide the education and resources for families that supports the work you're doing in your home, center, or school. This webinar is intended to help identify strategies for engaging families and parents and review best practice recommendations for all child care providers. Before we get into our discussion on the importance of family engagement, it is helpful to first take a look at the benefits of improving the health environment of our children. Children who eat well-balanced diets and are more active through supportive environments have shown to perform better academically. When children come to school nutritionally fed, they are better able to learn and play, pay attention, which can help increase participation in academic achievement. Not only have grades shown to improve, but when children who exhibit healthy habits, for example, getting an appropriate amount of sleep each night, eating nutritious foods, engaging in physical activity, and reducing the amount of time watching screens, behavior is shown to improve in these children as well. Recommendations to build supportive environments to help children develop healthy habits in the child care center and school include offering a variety of fruits and vegetables at every meal and snack, eliminating high sugar, high fat foods and beverages, offering recess before meal times, which is shown to increase appetite and help children settle down when it comes time to eat. Health promotion through posters and pictures of healthy foods and physical activity, classroom rules on healthy snacks, and role modeling by adults. Here's a good time to pause and reflect on what are some of the benefits you notice when children eat well and are physically active. I'll give you a minute to pause this slide and reflect before we continue our discussion. Okay, so how does family engagement fit into the picture of child health, particularly when talking about the child care and school environment? The Center for Disease Control and Prevention offers an entire section on adolescent and school health website under the Healthy Youth tab. A definition for family engagement by the CDC has stated, quote, parent and school staff working together to support and improve the learning, development, and health of children and adults. So on this website, a strategy guide is also available, which can be applied to most child care settings. The guide is referred to as the Parent Engagement Strategies for Involving Parents in School Health. You can access the guide and other resources mentioned in this presentation at the end of the resource slides of this presentation. The strategies within the guides are broad, but within each, specific interventions have been identified for helping meet each goal to increase family engagement efforts. The main categories of focus in this framework is suggested and explains that in order to encourage parent engagement in school health, schools can, 1, connect with parents, 2, engage parents by providing a variety of activities and frequent opportunities to fully involve parents, and 3, sustain parent engagement by addressing common challenges to getting and keeping families engaged. The information in this slide is referenced from the Improving Nutrition and Physical Activity Quality in Delaware Child Care Guide, a resource developed by the Delaware Department of Education and the USDA Team Nutrition website. The guide offers child care centers a similar guide to the resources for schools within the CDC's website. In this presentation, both resources will be utilized for offering recommendations for enhancing family engagement, as many strategies provided are applicable and can be utilized in both the school and child care setting. In the research presented in the resource guide, several benefits have been identified from successful family engagement implementation. One is supportive staff. Getting staff on board, so teachers who are working closely with the children day in and day out, is an important driver for successful engagement. support. One quote from the guide regarding family support is, "When families feel they are part of your center's community and see that their contributions are appreciated, they're more likely to become or remain engaged. Families can help you make improvements to your center that you may not have the time, money, or skill to do otherwise." Referrals is another potential benefit, so the more involved parents are, the more they feel their feedback and participation is valued. The happier they will be with their child's care. Happier families could mean increased positive feedback to family and friends also looking for quality child care. A healthy environment. So educating and involving families in the child's health will improve the overall health environment, from school to home and child care centers. So as you can see, there's seemingly endless benefits of engaging families in your effort to enhance the nutrition and physical activity environment of your center, home, or school, and providing support to all the hard work that you're doing. Okay, so let's assess. To begin the process of enhancing family engagement in your center, it's important to first assess what strategies are currently in place. This slide offers some areas to address for determining where to begin. One area we can assess is our activities. Some questions to consider may be, does the school or center invite parents to participate and contribute to school nutrition, physical activity, or health services, those related activities and programs? For example, does the school encourage families to participate in the breakfast program or through the free lunch program that the school provides, or to help encourage families to volunteer for the walk or bike to school program? How are these opportunities communicated to families? Another area for parent input is parent input. So what opportunities exist for parents to give feedback on how they'd like to be involved in these school and child care health activities? How is it that the input is received from the schools? So are parents who have given feedback, do they feel valued, or do they feel that it's viewed critically? Decision-making is another area we can assess. As for decision-making, does the school or center have a dedicated committee of teachers and staff who help to plan and implement activities to continually improve outreach to parents and the quality of the parent engagement activities? And then lastly, access. Does the school connect with parents who have non-traditional work hours or with families who maybe English is a second language? For child care centers, the Delaware Resource Guide offers a sample assessment tool that can be used for helping answer some of these questions. A link to this assessment, as well as the one for schools, can be found in the resource page at the end of this webinar. For schools, the CDC also suggests offering check-in questions periodically to provide families the opportunity to determine what the progress has been made and what areas can be further enhanced. While engaging families is important for enhancing overall health environment for children to thrive, it can also be challenging to meet the needs of all the families you are serving. This slide shows just some of the barriers that a school or center might face when working to increase family engagement. In an assessment of the WeTHRIVE program, some barriers mentioned from current WeTHRIVE child care centers in the implementation of family engagement strategies have been provided. One center stated that challenges with parent engagement activities is really getting a good percent of the parents to participate or even come to some of those events that have been scheduled. Another director said, our greatest barrier is just getting parents to read the information. I've left hard copies in the front desk, placed them in classrooms, and have attached copies to weekly emails to parents. Several times a year, we have representatives from the Comprehensive Children's Injury Center set up a table in our front lobby to talk with parents about car safety and home safety. I think this information is well received because it's more of an event and there are freebies given out. I don't really have the knowledge and time to make this an event, which I think may grab parents' attention better. And then finally, another director said their biggest barrier is just to remember to pass out the information each month, and the challenges of not having space within the center for a parent area. Here's an opportunity to, again, stop the webinar and jot down some barriers that you might face in your own center. And after a short break, I'll address some of the challenges and solutions that have been identified and ways to address some of those barriers. Okay, so in the CDC's Strategies for Involving Parents in School Health Guide, 6 common strategies to sustaining parent engagement have been identified. I'll take some time now to review the challenges and then offer up some sample solutions that can be utilized for addressing each barrier. The first challenge that's common for many centers and schools in sustaining parent engagement is that parents are unable to attend school or health or center meetings or activities because of schedule conflicts, a very common barrier. So a suggestion to address this challenge could be maybe scheduling meetings and activities to match varying parent schedules. This could be scheduling meetings and activities on Saturdays, or offering teachers incentives for attendance, or hosting meetings and activities after rush hours, providing meals for families who might be, if it was around dinner time. Another strategy is to provide incentives to encourage parents to attend at-school meetings and events. As was suggested in the recommendation from the WeTHRIVE Child Care Center, who said that parent turnout tends to be better when freebies are offered. You could offer child care or even food or refreshments in hopes to encourage more families to come. And a third strategy could be to provide alternative ways for parents to access the information and communicate with staff, aside from attending meetings and activities on the center or school grounds. You can do this by establishing an email or a listserv for the teachers and parents, or even using forms of social media, such as creating a Facebook page, sharing updates via Twitter, or getting parents involved in helping to blog about different events. A second barrier of parent engagement is parents cannot always attend the meetings and activities due to a lack of transportation. There's 2 potential suggestions for addressing this challenge. One is to help provide transportation, and maybe this could be done by creating a shared community ride board, so having families being able to help share rides, and providing bus tokens or other methods of public transportation fares. And then the second is to hold events off-site or online. So meeting those families where they're at, go places where families are already around, such as community centers, community organizations, neighborhood centers, housing projects, libraries, and churches. The third challenge is parents are uncomfortable at school and center meetings and activities. And this discomfort may be the result of negative experiences from when they were in school, or unfamiliar with the school culture, or just other factors. One suggestion for addressing this challenge could be to provide opportunities for parents to get to know the center staff in non-threatening ways. This could be hosting an informal get-together throughout various times throughout the year, providing continuing education opportunities for parents, having a designated greeter to ensure that every family member is welcomed when they come into the center or school. Another strategy suggested is implementing programs that are culturally sensitive and that reflect the social and environmental aspect of a community, influenced by race and ethnicity, socioeconomic status, locale, and culture. And you could do this by assembling a representative group of all the parents at meetings and activities, hosting social and multicultural events to connect families, and promote diverse meals and healthy food served at school meetings and activities. The fourth one is that parents not fully comprehend the health information and communications provided at these activities and meetings. This might be due to the language barriers or unfamiliar with terms. So one suggestion to address this challenge is provide translation services for non-English speaking parents. And another is to reduce barriers to understanding this information. So trying to avoid professional jargon with families, and preparing materials and providing information at an 8th grade reading level or lower. Okay, so the fifth challenge to parent engagement strategies that's been identified is that staff are not always experienced or trained to work with parents, and sometimes have trouble trouble sustaining relationships and parent engagement efforts. Two suggestions to address this are provide professional development opportunities that focus on strengthening parent engagement, maybe providing a flexible schedule for professional development to accommodate staff members' schedules, and develop strategies for working through staff resistance to change, turf issues, and power struggles that might hinder parent-teacher interactions. Ways you could approach this strategy is to provide teachers with sample model assignments that include parents, talk with staff about concerns related to parent engagement, and provide coaching to the staff to how to interact positively with parents. And the last commonly identified barrier is that there's difficulty sustaining school administrative or financial support for family engagement. So one great way to address this challenge is to seek opportunities for financial support. This might be done through looking for grant-funded program opportunities, initiating strategies that require little or no financial support, and soliciting funds from community partners. So resources such as the Parents for Healthy Schools is a great place to start to access resources in assessment, planning, and implementation of parent engagement strategies. Several of these we've already seen or will use throughout the presentation. Another area for strengthening parent engagement in your school is through policies. Policies are important for helping to establish the culture and expectations of everyone in your center and school. This slide highlights the new rule for the local school wellness policy. As you can see, parent and family engagement is emphasized throughout. And many of these required policies that are listed here involve families, such as policies on food and beverages, healthy celebrations, and even participation in the development and implementation of the school wellness policy. This slide is again referencing the resource guide provided by the Delaware Department of Education. Although there are many other great resources out there to choose from that also offer great guidelines and tools for assessment and strategies for engagement. Another place you could go to access free family engagement resources are at our WeTHRIVE childcare website, which you can find at WeTHRIVE.org. On the website, there's a month-by-month resource guide. It's designed in a way that makes it easy to share with families. You could simply print out and hand the information to families, add the information to your newsletters, bulletin boards, or even share through various social media accounts. The USDA offers a variety of helpful resources for developing policies in the child care setting. The Red Center for Food Policy and Obesity offers a sample child care policy for directors to use when enhancing center policies on nutrition and physical activity. This slide shows a snapshot of the types of policies that are recommended for including in your parent handbook. In partnership with the USDA Team Nutrition, the Improving Nutrition and Physical Activity in Delaware Child Care Partnering with Families Resource Guide outlines strategies for family engagement and offers resources for implementation. In 2011, NMORS met with several parent groups from various child care centers in Delaware. The purpose of the study was to find out what concerns parents might have about their child's health, where parents are getting their information on their child's health, how parents currently communicate with child care providers about their child's health, and what types of information parents would prefer to receive from their providers. The results of the study revealed that parents in the discussion groups showed that they were most concerned about their child's eating habits, physical activity, and development. When asked about physical activity concerns, family members mentioned needing more information about meaningful, structured physical activity, especially indoors. Finally, child's healthy development was a common concern. Parents shared how they may have many questions and concerns regarding their child's physical, mental, emotional, and intellectual development, particularly in the critical first 5 years of life. The research shows that families are eager to receive information and form closer relationships with teachers, staff, and administrators at their children's child care center. This slide refers back to the 3 categories for enhancing family engagement offered by the framework of the CDC Family Engagement Resource Guide. The first of the 3 tiers of the Family Engagement Framework is connection with families. So what are some strategies for connecting to families? Characteristics for successful engagement include asking parents how they want to be involved in the school and center activities and events, offering families and staff a clear mission and vision that includes parent engagement. So that could be done through that implementation of policies. Creating a welcoming and inclusive environment. So what kind of culture have you set in your child care center or school? Offering frequent engagement opportunities and a variety of communication methods to reach families where they're at. And providing staff development for engaging families. The second strategy, after building strong connections with families, is to increase opportunities to engage with families. 3 strategies for engagement have been identified, and they are motivate parents to support healthy school and child care environments. How do we motivate children, you may wonder? So through engagement. So trying to encourage families to participate can help lead more families to participate. The second is educating families on how they can support healthy eating environments. And third, getting parents to take action, making sure you provide specific action-oriented steps for parents to take, such as preparing healthy snacks at home with your child to bring to the classroom celebrations and school activities, volunteering to help with physical education class, recess, or before or after school physical activity programs, and encouraging them to get involved in decision-making groups at the child care center or school, nutrition, local wellness policies, and other wellness activities. The last category from the CDC framework is sustaining the relationships and engagement that's been developed. The CDC recommends the following strategies for sustaining parent engagement. 1 is to appoint a dedicated team or committee that will oversee family engagement. So maybe selecting a few involved families within your child care center or school that can lead this group. And 2, identifying challenges that keep parents from getting involved and work to address these challenges continually throughout the year. How could you assess those barriers? We already did some of this work in identifying barriers to starting family engagement efforts, but as we develop these strategies, it's important to assess the impact and success of the strategies in place. Continuous assessment of potential barriers to families participating should be done, and also developing strategies to address those barriers will further help enhance parent engagement and family participation. Let's talk a bit more about specifics about what are some different opportunities for engagement. This slide shows some of the many opportunities throughout the school and child care day where families could be included and encouraged to participate. In terms of offering family educational materials, you could provide resources in a variety of formats, perhaps giving them to parents at school or center events, meetings, or parent-teacher conferences, one-on-one conversations, adding them to students' work or teacher-parent communication folders, adding them to the school websites, newsletters, or emails, making them available in the parent resource area or room. Strategies for effective communication include providing information in your family handbook on the importance of strong partnership. So sharing with families why you value their involvement and what you could do when you work together. When families sign up at your center, maybe ask them to indicate how they would best like to receive information and when and how they would like to get involved. You may discover valuable resources and advocates in the family members of the children at your center. And share information with families through a variety of avenues. Maybe it's daily sheets, newsletters, bulletin boards, electronic methods, and face-to-face communications. And schedule parent-teacher conferences at least once a year, or at least twice a year is the recommended for best practice. Some ideas for family nights from the Partnering with Families Guide include hosting a family adventure walk, inviting families to a cooking class, creating a culture or hobby day, host a family potluck, have a turn off the TV screens week. And these are all just some of the many ideas that you could implement in your own center at home. Once again, I'll give you a few moments to stop and reflect and brainstorm some strategies and opportunities for family engagement that you would like to start to implement in your own center. There are many different ways child care centers and schools can encourage families to offer feedback and suggestions, which can help to strengthen relationships and increase parents' desire to actively participate. What are ways that you obtain feedback? Let's look at some of these strategies. In the Getting Feedback from Families resource guide, there's been several suggestions. One is to conduct an interview. When families enroll in your child care center or school, it could be helpful to schedule a meeting to learn more about what's important to the family. Different discussion topics could be the special needs of a child, how the child reacts to particular situations, and what kind of information families would prefer to receive about their child's care. You can do face-to-face communication, so during pick-up and drop-off times, this would be a great time to have just a friendly meeting, an opportunity for staff to communicate some of those topics and have those informal conversations. Having a suggestion box, so encouraging families to share thoughts and ideas with you, checking the box each week, and providing feedback and thanking families for their feedback. Sending out surveys once or twice a year, satisfaction surveys, and provide ideas about various aspects of your center. Think about providing incentives for the families who complete the surveys. Or maybe ideas for recipes or menu ideas, getting parents involved even in the menu planning. Their recipes may be ones that the kids really like to eat, so create a box or a container where families can leave their ideas. And then providing electronic communication forms. There may be daily journals to just find different avenues and ways to communicate with families. Okay, so what do families want? There's some research out there that worked to obtain this information. To review from the numerous parent discussion from the child care centers, what they showed was that parents wanted information materials to be simple, to the point, action-oriented, so giving parents specifics on how they can get involved. They wanted it to be realistic, so taking account time and money, and then be available in different formats, so paper, emails, posted on the website, sent in text, face-to-face. And those resources that were most requested are information on motivating picky eaters, recipe ideas, children's books on healthy foods and active living, monthly menus, handouts, activity calendars, and tips on incorporating healthy eating into the family's lifestyle. So with that information, maybe a good idea to include in your strategies ways to hand out some of those topics for families. The Partnering with Families guidebook has some success stories from child care centers. A couple of them I'll share with you to show you how some of these strategies can be put into action. Example one is from a story from Glenna Kemp, a director at Dover Early Learning Center. In her story, she shares, "When we started our physical activity program, we wrote a letter to our parents asking them to please make sure their child had a pair of sneakers and socks at school daily. In addition to the letter, we put a curiosity sign by the front entrance. It's basically a piece of folded up paper. On the outside is big letters and it says, 'Remember' in bold. When you lift it up, on the inside it says sneakers and socks. Most everyone reads the curiosity sign and smiles, and most children come to school with their sneakers every day." So this could be a great strategy for helping some families to remember some of those things that you would really like them to provide for their children each day. One idea could be for that curiosity sign is warm jackets and hats and scarves for winter so kids can continue to play during the cold winter months. Example 2 is from a director at Newark Day Nursery and Children's Daycare, and their director states that we have a large variety of communication methods, the intent being parental information. We have the standard weekly lessons posted in each classroom, daily notes for younger children, and monthly updates for all rooms. A few new initiatives include a double-sided, legal-sized mini newsletter called Chit Chat, distributed to parents every 2 months. In this newsletter, we feature a classroom or group of rooms discussing an activity, curriculum, area, or event, a healthy child-friendly recipe, and staff updates. We also have a new bulletin board by the front door, created monthly by a different classroom focusing on nutrition. For example, Marching into Health had pictures of foods children had cut from magazines, in different colors arranged in a rainbow pattern ending in a pot of gold. Children love showing their work to their parents. We also had a daily wipe-off board of the day's menus. It's great to hear the parents and children chatting as they read it upon arrival, and then talking about how they liked it as they leave. Monthly menus are posted in each classroom and available to take home. And then similar postings and verbal communication are frequent regarding children's physical activity. We also try to have home visits come into the center who provide additional opportunities for physical activity, such as African drumming and dancing, or storytelling with animal moving and dancing. Most of our classroom events have a parental involvement invitation, and the refreshments are nutritionally sound. For example, monster-faced pizzas for Halloween with veggies for fresh toppings. So those are just a couple ideas and stories of how other centers have been successful in implementing some family engagement strategies. USDA, partnering with Families Resource Guide, and CDC Healthy Schools website are a couple great places to visit for additional resources for schools and child care centers that are helpful when planning and implementing the new parent engagement strategies. The following slides are the list of web links and resources of the information provided throughout this webinar. Many of these links would be a great resource to keep on hand as you continue to develop and assess your parent engagement plan for your home center or school. Thank you all for joining me for today's webinar, and I hope you found the information very helpful. Feel free to email me or call with any questions or feedback on today's topic. My information is available on this slide. Thank you.